Welcome to an IDB webinar, Pandemic and the New Normal for Logistics. I'm Bill Buzzy. I'm a program director at the Institute for Defense and Business in Chapel Hill, North Carolina, and it's my pleasure to act as the host and moderator for today's panel. I want to thank so many of our friends and alumni who have joined us this afternoon. We know that there are a lot of webinars out there, and we're very glad that you're here with us today. It promises to be a very interesting conversation. For those of you who are new to the IDB, thank you for joining us. The IDB has been serving the defense community to include all the military services, the DoD, non-governmental organizations, the private sector, and the commercial world with executive education programs and research for the last 22 years, and it has been an honor for us. Just a few ground rules before we begin. I will ask each panelist for an opening statement or remarks. Then, without much interruption from me, we will enjoy their interaction as they help us understand possible futures, ideas, and current activity. We will have a Q&A segment in the program for as many questions as time will allow. I'll probably go to that about 2:40. You can submit those questions at any time using the Q&A area of your Zoom screen. And if you wish, you can submit a question for a specific panelist. In addition, a recording of this event will be made, and you will be emailed a link to access that recording by tomorrow at the latest, we hope. So, let's begin. The impacts and effects of COVID-19 pandemic that we are witnessing today were probably unimaginable even 6 weeks ago. Now, our new reality consists of safer at home, social distancing, wearing masks, working from home, furloughs, and for many people, severe economic challenges. And while the pandemic is affecting us all, the degree and severity of its impacts on our supply chains in the DoD, the commercial world, and healthcare has been very significant, and in some cases, catastrophic. So to discuss some of the ramifications of these impacts, the IDB has assembled an amazing panel of both knowledgeable and accessible experts to be with us this afternoon. Let me introduce them. General Paul Kern is a senior counselor with the Cohen Group. He has served as president and COO of AM General and is currently a member of many corporate boards and the Defense Science Board. General Kern retired after a very distinguished 38-year career in the United States Army as the commanding general of the Army Materiel Command. He's a graduate of West Point. He holds master's degrees in civil and mechanical engineering. General Kern was also an early and instrumental proponent for the IDB and also served as one of our executive fellows. Mr. Jim Brunke is president and CEO of Calligridis International. Jim retired as a senior executive at the Boeing Company after a 40-year career in aerospace engineering and logistics. In separate assignments at Boeing, Jim served as director for all of Boeing's commercial and military maintenance, repair, and overhaul facilities. He currently consults for McKinsey & Company, among many other organizations. He's been a senior mentor and lead faculty member for the IDB for over a decade. He's an engineer and holds a master's degree in business administration. Dr. Anand Iyer is co-founder and chief strategy officer at WellDoc, where he leads complex analyses of real-time data from WellDoc's mobile prescription-based therapy app, Blue Star. Anand was a founder and past president of the In-Building Wireless Alliance, as well as a top 35 executive in wireless and Maryland's Healthcare Innovator of the Year. He has earned PhDs in both electrical engineering and computer science, as well as an MBA. Dr. Iyer is a most valued senior faculty member at IDB. Well, it appears we're not lacking in engineering expertise today. I think we have it pretty well covered: civil, mechanical, aeronautical, and electrical. So welcome to each of you. Gentlemen, in our earlier conversations, we talked about watching supply chain trends, keeping up our momentum, our broken healthcare delivery system. So General Kern, I'd like to begin with you. What are you and your clients most concerned about as we live in this very fluid environment we find ourselves?
Retired now for almost 15 years, but we'll focus on what we can do about what the problem is in the supply chain across the logistics channels and across the military. Let me start by thinking through 4 or 5 of the companies I just started working with right now during this pandemic exercise. 2 of them in the manufacturing area had thought through ahead of time what was going to happen and were prepared for it. They had childcare plans, they had different structures for their people who had families versus those who were single. They split out the workforce and they had different timelines. Another company who was in the heavy manufacturing said, we're not going to lose momentum. We're going to continue hiring. We're going to continue looking. A third company that was in the insurance areas looked at it and said, you know, we saw this coming for quite a while, so we're going to just make sure that everybody has the ability to work from home. And so they shut down very early in their offices and opened up. And the amazing thing when you think about this is we're 20 years now into the 21st century, 1/5 done. And we continually get surprised. First, it was by our computers that we thought wouldn't make it from 1999 to 2000. Then it was 9/11 attacks on the United States homeland. And now it's a pandemic, somewhat referred to as predictable surprises. All of these things we should be planning for. So that's the first lesson I think that I get away from it from our folks who work in the logistics and the defense area. Plan ahead, plan for disruption. Supply chain, we're finding out, is very critical. Many of the companies we work with in the defense sector have a significant amount of the supply chain in Mexico, even some of it in China. And they are working rapidly right now in multiple countries to figure out how to deal with it. Another couple of the companies work in 3 or 4 different countries, and they are trying to figure out how they balance all the workloads from one to the other with different sets of laws. Aircraft industry in particular, I think, is going to be particularly hard, and I'm sure Jim can comment more on how he sees that. But we see all the airplanes grounded. We see 737 MAX having had a major impact. And what is that going to do in the defense sector? What kind of costs is that going to impose on our business? Healthcare in the defense sector hasn't gotten a lot of press, but believe me, I've spent a fair amount of time working with a number of companies, from the JPEO, who does biochem work, who is working on vaccines, who are helping now with the pharmaceutical industry, others that are helping try to figure out how do we do this in testing, and the National Guard being called out to set up and help and run medical centers. The cycle of moving people in the Defense Department has had another big impact. We stopped it. So all those trucks that were going to be moving people around this summer at the school years ended are going to get backed up. And so we're going to see a major impact, I think, as we already have in some sectors, but particularly in just the people factor in the Defense Department coming up. And then I think about crew safety. How are we going to start dealing with things like spacing? So we've stopped and we've restarted some of the areas of basic training, and how we get into the advanced individual training, and how we move people into the sector so that they can actually get to work. So these restrictions, which Secretary Esper has put on until the end of June, are going to have a significant impact. So I think there's probably everything you could think of that I just discussed, plus a dozen more, are going to change the way we do business when we get through the end of this pandemic, which may be through the whole year as we start into the fall flu cycle. So I'll stop there and listen to our other engineers and make sure we have a good discussion.
Jim? You're muted. Okay. There you go. Muted.
Got it. Okay. How's that?
Good.
From a business perspective, I'd like to talk about it kind of from a macro way and then get into a micro bit. But first thing is there's probably 3 steps we ought to be taking right now. First step is keeping our people safe and understanding how to keep our business our business or our enterprise in operation or in some state of preparation ready to go back live when we're told to do that. Second one is we ought to be monitoring what's going on around us. We ought to be monitoring what the regulations, the laws are, what the state and local governments are telling us. And we ought to be monitoring on funding and availability of budget as we go forward, because that's going to be a big scramble for all of us. The third thing we ought to do is this is the time that we can plan ahead. We have some industries that are running down the rails 100 miles an hour, and those are things like the medical industry right now. We have other industries like the airline industry that's not moving at all. The slower industries, the ones that aren't working at full capacity, this is the time to do the things that you always said, if I have time to prepare for something, this is what I need to prepare for. So a great time to clean your weapons, sharpen your swords, and get ready for full-scale operation in the near future. Part of that should be reassessing your supply chains. We've talked about that to some degree already. First off, have your risks changed? Maybe your risks haven't changed, but maybe your perception of your risks have changed. One thing that kind of surprises me is that we are surprised about a pandemic. We've had Ebola, we've had MERS, we've had SARS, we've had bunches of pandemics over the last 10 years, which should have raised our attention that these things are going to be a continuous way that we're going to operate going in the future. So the new normal indicators have been out there for quite some time. We've just failed to address them. But I want to go back and talk a little bit about the risks. There's 7 major risks in a supply chain. We have transportation risks in a supply chain. We have political risks in a supply chain, where some country may not want to participate in a supply chain, and we're seeing that. We have environmental risks. Those are more geographic, tsunami zones, tornado zones. Should pandemics be put in there as a geographic risk now? Is China a source of more pandemics than other locations? And does that change our decision-making whatsoever? We've talked cyber risks before. We've talked about suppliers unable to deliver. We've talked about material shortages, and the last risk is all about unreliable or unserviceable parts and components, things that don't meet specification. If we think about where we are today, every one of those risks has been affected in some way, shape, or form. An example of transportation risks. Since February, air freight has gone up 400% in pricing. That's a huge impact on people that are shippers. That ship a lot of material around. So all of these risks we ought to look at, we ought to address them, we ought to decide whether we want to shift our view of them, we ought to look at our supply chain strategies, and we ought to make the changes that are needed to be made now rather than waiting for the next pandemic to come.
Anand.
Yeah, excellent points made to date, and maybe just a comment. I just wanted to shout out to all of the first responders and to all of the medical staff who are out there in the front, and our brave men and women serving our armed forces for all that they do during these unprecedented times. If I were to take what General Kern and Jim have talked about and now put a slight, if you would, a little more focus on a healthcare view of this. During normal times, our healthcare system is designed, and it's really been designed to handle acute care. You have an issue, you need something done, you go to an acute care facility, be it your doctor's office, a clinic, a hospital, and in many ways, the system is actually built around the handling of that acute care. But in the midst of that, there's 2 parts of our care chain. The same way we talk about supply chain, there's a care chain. And the care chain has to take into account what's happening with chronic conditions, or people who suffer from cardiometabolic conditions like diabetes, like congestive heart failure, like asthma. But we also have to talk about preventive care, those actions that can be taken by healthcare providers and certainly by individuals, consumers, and patients to actually stay in the safe zone. And so when you look at this complex web of what healthcare delivery and healthcare services delivery is intended to do across those 3 domains, you think of a supply chain for sure, There's a physical supply chain of what they call durable medical equipment. There's a pharmaceutical chain, the drugs, the medicines that people need to take. There is a services chain that may involve services from a doctor, it may involve services from a dietitian, from a certified educator. And then of course, there's all of the support and administrative chain. How do you actually bill? How do you actually collect? And in many ways, what COVID-19 has done is it's uncovered in many ways some of the foundational flaws that we have. And you think about the thinking of people like Jeffrey Moore, who classify innovation into two buckets. There's situational innovation, let me solve the problem at hand, but there's foundational innovation, or things that will actually be required to scale and accommodate what General Kern said, that in many ways we have to plan for the unplanned. People measure velocity. Velocity is your ability to respond to a known change, a predicted change. Well, agility is different. Agility says it's a response, of course, but it's a response to an unknown change. I just now found out what the severity of the COVID-19 spread was, or updated statistics in my zip code. What do I need to do? And in many ways, there's an opportunity, enter stage left, for technology and technology innovation, and the data that comes along with technology innovation. Imagine where we could actually correct our supply chains. They call them self-healing, by actually using data to drive what the supply chain actually does, and how it auto-corrects where there's shortages, how it auto-corrects where there's fractures, where things just can't happen. Think of what's happening today, even as late as yesterday, with the predictions about the food supply chain in the United States as it relates to the production and the distribution of meat products. Imagine if we could have a Google Maps-like function for the supply chain. When I go off course in my Google Maps, it recorrects me. If there's a road closure up ahead, it auto-corrects me back to a safe route that will actually get me to where I need to get to. And so when I think about COVID-19 and I think about the healthcare chain, just some interesting statistics that come to mind for those people who suffer from chronic conditions. That of all the people who have tested COVID positive in the United States, 51% of them are hypertensive or have high blood pressure. 41% of them, 44% of them actually, are obese, and 34% of them have diabetes. On average, the normal incidence of diabetes in the United States, according to the CDC, is 12.7%. So it's a 3x increase for those in this case who have been tested positive. And so is there hope, for example, in the introduction of technologies, in the introduction of apps, in the introduction of connected devices and sensors, in the introduction of workflow and integration of workflow and data into workflow? And can we actually help, if you would, solve this conundrum where doctors find their waiting rooms empty and patients find themselves not being able to get in their car and drive to see their doctor for something that may not be an acute emergent event? And in doing that, we think about the actors that are there in place today. We think about the FDA. How do you ensure patient safety? And how do you ensure good quality manufacturing process for all the new entrants who are flooding the market? We think about cybersecurity. How are we ensuring the security of all of our data as it passes through the hands of these new and established actors in a way that preserves the integrity of that data such that they can actually deliver the intended clinical value? How do we do this in a manner that's positive from an economic ROI and a value to cost perspective? And so as we think about disruptions in the supply chain, as they relate to health and as they relate to some of the other supply chains that Jim mentioned, we have to think about how a taxonomy of technologies, whether they're apps, whether they're data, whether they're systems, how these things actually support this new cast of characters in the new world that is COVID-19.
So each of you talked a little bit about risk, and we talked about technologies. What do we do about the risk of counterfeit products, counterfeit medical equipment that we've all read about in the supply chain? Counterfeit airplane parts, for instance, Jim.
Well, there's a couple of things here. I think we have to look at it from two perspectives. Airplane parts, I don't have as much concern about, because that's a fairly well-defined supply chain. We know who the sources are. Most cases, we've been working with tier 2, tier 3 suppliers for 20, 30 years. We're pretty good on that. New entrants, we would have to worry about. But there's a lot of regulations in, for instance, the aircraft industry and even the defense industry that at least require monitoring for counterfeits. The ones I worry about most are the ones that are going out to consumers, or are what I'll say are imminent surges, things that are happening like right now. N95 masks are a great example of that. You can go on Amazon today. You can buy an N95 mask. You probably won't get it till June or July. They may cancel the order on you. That's a whole nother conversation. But you know, Amazon doesn't certify any product that they send to anybody. They leave that up to the supplier to provide those. And there's a relationship there that doesn't work. I don't have a direct relationship with the supplier, so I don't really have a good way to go in and interrogate those. So I think we've got some real big open issues with third-party logistics providers that don't have responsibility for assuring that certifications or the quality standards for products are met. I do know for a fact today that the N95 masks use a thing that's called a blown melt filter fabric. And the machines that create that fabric are made in Germany. And they can make material enough for 2 million masks a day. And I know that the companies that are making N95 masks, especially in China, have upped the production of those machines from 2 million a day to 22 million a day. And the German manufacturer of the machines say those blown melt fiber filter fabrics can't be set properly to screen the particulates in the manner that they're supposed to when you don't give them time to set. So in our zeal to increase our production capacity, in many cases, we're creating fractures in the system that is supposed to be providing quality masks for all of us. So we got some big issues there on the consumer product side and the surge side. Like I said, though, aircraft and defense, I'm much less concerned about quality and standards. I'm much more concerned about delivery capacity and capability.
If I could just interject a thought. I work with a group up in Massachusetts that is taking on this issue, and it combines government and it combines it with the capabilities of the industries that they work with in the fabric world. And so they have taken MIT, Lincoln Labs, the Natick Center, which works all of the fabric and clothing issues, and put them together and then expanded that to say, how can we find everybody who has the testing capability? Up to that point, within the defense sector, it was simply the people who were working in the, excuse me for the noise. It happened just like what you said it would. The capability was only in the JPO and in the biochem defense people who actually knew how to measure mass filters and to do it. Now we're finding out where else you can do it. And so I think that's the kind of thing in terms of reducing risk that you need to think ahead about, where these risk factors can be reduced. And to Anand's point, how do we use autocorrect in those kind of things so that we have systems that say, okay, we can identify all of these capabilities very quickly. I have seen that in a couple of the places that we do work. In the business, believe it or not, back to your thought on trucking. I worked with a company 10 years ago that didn't own a single truck, that provided trucking capability across the United States and in fact internationally. They did it through a command and control center. They provided trucks the local best prices for fuel, where the best routes were, how to avoid hurricanes, how to reroute traffic. So we have some capabilities that are out there to mitigate risk, and how we apply them more universally, I think, is the real challenge that's in front of us.
Let me share with you an example, Bill, of how we're actually doing it in the digital health industry. If you were to just go today to the Apple iTunes store or to the Google Play, the Android store, and just count the number of digital health apps, they're in the tens, if not hundreds of thousands, and they claim to do many things, oftentimes falsely. And Welldoc was one of 4 companies alongside 3 others. One, Voluntis, 2, Achille Interactive, 3, Pear Therapeutics, and we collectively came together to say, how can we actually ensure, to General Occurrence point, how can we actually ensure the integrity of these solutions? And one of the things that actually came out of the alliance was a need for ensuring that the solutions themselves are clinically validated. No doctor is going to prescribe, even if they now have a billing code to use for it in a telemedicine consult. No doctor is going to prescribe something that isn't trusted, that hasn't shown clinical evidence. So the same rigor that we would apply to drug development or new medical device development, we have to apply here. We have to ensure that these things have passed through the hands of the FDA. And that means really 2 things in English. It means that it's safe for a patient to use, and it means that there's some good quality manufacturing or quality management system and process in place to ensure that what you've done is repeatable, scalable, and measurable. 3, we absolutely have to ensure in this world of data, cybersecurity. And we have to ensure that we're taking all the precautions to necessarily encrypt, authenticate, non-repudiate, all the fundamental building blocks that are required to drive a cyber solution. And so I say this because in the case of your original question, which is how do we ensure protection against counterfeit, for example, I think there are things that used to be nice to have that are now must have. And these must have capabilities have to be built into the fabric of whether it's a product layer, whether it's a service layer, whether it's a data integration layer. We as companies in a public, private, military collaborative fashion have to ensure that these things become foundational and they're not nice to haves anymore.
So the questions are coming in, and I'd like to invite everybody to submit questions now if you'd like. But there was a quick one on that someone has submitted about the statistics that you gave regarding COVID-19 positive folks that were obese, had high blood pressure and diabetes. They missed that. Could you repeat that?
Yeah, it's 54%. So of all the people who have tested positive COVID in the United States, 51% are hypertensive, 44% have they're obese, so a body mass index above 25, and 34% of them have diabetes. And I give the diabetes comparative statistic that today the average in the chronic space, as published by the CDC and the American Diabetes Association, is about 12.7% of our population having diabetes. And so it's 3x. And why is that of relevance? We know from the clinical experts that COVID-19, whilst it's an equal opportunity disease, you can get it, tends to focus on and tends to have a higher hit rate for people who suffer from some of these chronic conditions. And so it's even more important in light of the fact that they can't see their doctor, in light of the fact that they may be at home, in light of the fact that their pharmaceutical chain may be disrupted, their supply chain may be disrupted, their care chain, if they have somebody come in visiting them at home, may be disrupted. These types of solutions that are driven by technology offer hope, and they offer actual clinical value, if you would, for the cost ratio. So they actually deliver ROI in the system.
Thanks. I have another question that came in. Do you see the supply chain getting back to normal, whatever that is, when the pandemic ends? Or do you think this will forever change the supply chain, creating a new normal?
I'll take a swing at that. I think it's changed forever. We have focused on lean, and we've focused on a concept called the global factory. And that's kind of been the way we've operated over the last 15, 20 years. We started out by what we called outsourcing. And we would outsource bits and pieces to countries to give us bits and pieces back, so we would do the final assembly. That's shifted now. We now have a global integrated factory. Apple can get assembly done in China. They can get bits and pieces done in China. We can send integrated circuit chips over to them. They can put them in. But generally, a component or something like a phone passes through multiple countries before it gets back to the end user. Some of that's going to change. We focused when we were building this global factory on two things. We focused it primarily on price, and we focused it on delivery speed. How quickly can we get it, and how cheap can we get it? And that's changed. Those fundamental things have started to change. Now we're going to start also looking at delivery reliability. Can you deliver under any conditions? And another thing we're going to spend time with is quality and certification. We let our quality standards slip when we started applying lean principles and trying to reduce inventories. We tried to increase the speed and reduce the price of what's going on. Those fundamentals have changed on us. And there's some opportunities here too. China's going to end up with a bad rap for a lot of reasons on this. I think not only we can talk about whether they were or weren't the source, but they've actually slowed deliveries down in some respects because they had worries about certification processes. So it now takes about 10 days to get a mask out of China, where you used to be able to get it in a day or two. There's things that we'll start looking at from a perspective standpoint. Mexico is the fastest growing by percentage of manufacturing capability in the world. If I ship an iPhone by ship from China, I'm going to get it in 2 or 3 weeks. I can get that same ship to go from Mexico to New York in 3 days or 2 days. So there's some fundamental thought processes of where we used to just say, well, we'll always go to China because it's cheapest and it's fastest. I think those will all be brought into question now. So from that perspective, I think it's going to change a lot. Is our capacities going to change? I don't think so. That'll all kind of go back to normal, but how we source, where we source, and what risks we apply to the supply chain and what we think we should manage, I think are going to change dramatically.
General Kern, what's your perspective on that?
I agree. I think we're going to see change, some because we will absolutely have to exist in the future, some because we will rewrite some of our specifications and regulations, as Anand mentioned, to enforce those things. And then we're going to have to really figure out through some things. So I think about it, and we talked about this a couple of days ago. From a military perspective, we build surge capability. We do it through stocking war reserves. Now, we don't always do it perfectly, and we always don't have exactly the right things, but we have a plan on how to do that so that when we get cut off from something or we have to do something more rapidly than we had in the normal course of action, we have the ability to surge. Now, if you put that in the commercial sector, that means building inventory of things that you will have to span a gap when you can't get to a component or a supply chain. There's a cost to that, not just the cost of storing it, but the way our financial systems are set up, it will hit the bottom line. And so how are we going to adjust for being able to surge through those types of things and not penalize people financially? The other things that I see that we're going to really be able to do is how we do the whole concept of risk management. The government, I will tell you, has been terrible at looking at supply chains. We relied on the OEMs to be the source of supply, and very rarely do we get down to looking below maybe the first or second tier. Probably 90% of the time, it's only the OEM. So I think we're going to see a change in how the defense organizations like DLA, which is in the parts business.
Well, we seem to have lost General Kern.
Got it.
Oh, he's back. He's back.
I'm back. Sorry. I had another phone ringing and it had worked on the same internet line. So I think there's going to be multiple changes to account for it, but I don't think it will go back to the norm that we saw for the last 20 years. I agree with everything that that Jim laid out there about how we have applied our effectiveness or lost effectiveness to achieve efficiencies. And now we're going to have to find a compromise.
And Bill, if I may, it's just, again, fascinating dialogue and great perspectives. I'm going to abstract it up a couple of levels from a commonality perspective, which is, if I were to grossly characterize in a very broad brush the supply chains of today And if I were to characterize where I think the puck is headed, what are the supply chains of the future going to look like? Or dare I say, what must they look like going forward? The nature of our supply chains today tend to be more fixed. Right? They tend to be more, if you would, wired point to point between actors for specific products, for specific services, et cetera. I think the key word for us going forward, if we all believe that there's going to be a new, is adaptive. And adaptive means they have to interpret. So it's almost a continuous sense and respond. They have to be able to sense what's actually happening. They have to predict based on mathematical modeling what may happen, and they're going to have to use the outputs of those mathematical models to actually then adapt the supply chain. And so I think going forward, the business of adaptability, the business of flexibility, these things can only be done and achieved if one actually has the ability to sense and continuously sense and respond. And I think in many ways, what we see exposed today, and anybody can glean this just by watching the news, is you have a federation of inputs and perspectives. California has a point of view, New York State has a point of view, Texas does, the US White House has a different point of view. And in many ways, I can expand that outside the four walls of the boundaries of the United States. China has its view, Canada has its view, Italy is suffering in great ways, et cetera. And I think we're going to have to rethink how our global supply chains, whether they're product, whether they're service, whether they're health, whether they're data, all of these things are going to have to flexibly adapt. And we may have to partner with, brand new folks. We may have to understand what that means to configure our supply chains. But I think the new word going forward that we should all embrace is we've been talking about agility for decades. Now we actually have to implement agility if we want to win this battle.
Anand, that's a good segue to this question that we just received on 5G-based smart warehousing supply chains. So the DoD is interested in investing. Are they interested in investing? Is commercial investing in that technology for smart supply chains? Is it paying off? Will it make us better prepared for the next pandemic or supply chain challenge?
Just put myself back on mute. I think the short answer, Bill, is it'll follow a trajectory, which is the rolling out of 5G. So for the folks who may not be as close to it as others, 5G is an unusual evolution. So 2G cellular to 3G cellular was a uptick in speed, bandwidth, coverage, right? Capacity, some basic vectors of any wireless communication system, as it was from going from 3G to 4G LTE. 5G actually opens up a different dimension of use, which is, can I actually, because I'm now moving to a fundamentally different set of frequencies that don't propagate very far, but they penetrate very well. So you start to think about the in-building, the in-house, the closed environment, where I'm now connecting multiple devices, and I'm able to connect multiple devices in what they call mesh networks. And so the concept of 5G is really there first as a consumer innovation play. It's there to allow me to have a completely connected high throughput pipe in my house. So my refrigerator and my dryer and my phone and my laptop and everything can talk to one another, with little interruption, if you would. I think the initial play there is to deliver a consumer value proposition. That's what you hear from the Verizons, the AT&Ts, the Sprints, et cetera. What you're going to see, though, is that innovation making its way back into the supply chain. Can I deploy that kind of technology in a depot? Can I deploy that kind of technology in a large establishment, in an office building? Can I use it to coordinate through sensors, command and control response for first responders? I think that's where the puck is headed, Bill, but it's going to start with the consumer innovation and it's going to work its way back into the supply chain. They will definitely benefit from that kind of innovation, and I think very shortly.
Thanks.
Bill,
Go ahead.
I just want to say, I think there's part of this discussion goes about Um, will your supply chain change? Should it have changed? How will it be different? And what will I need to make decisions in the future? As Anand said, the decision making has a lot of stakeholders in it in some areas of industry. And the question is going to be, what information are we going to need to make what decisions going forward? And I think that the decision making in supply chains is going to become more robust, more complex, more sources, and is going to become more data driven. And so I'm all in on we're going to need better systems, better security, et cetera, et cetera. But the other question we ought to be asking ourselves is, how does our information set change, and what information do we not have today that we're going to be needing in the future? And I think putting our attention there to determine how we're going to make more robust decisions is a worthy effort to do.
So do you see industry setting new standards that the government will follow?
I don't think I think it's going to be driven by the economics. Industry is going to have to adapt first, and I think the standards will follow to find what are the best solutions to it. You know, we've always worried about single points of failure in supply chains. Most industries will look at that, but people haven't put it on the top of their list of finding real other sources. And then you add to that the transportation issues that Bill laid out earlier, and say, okay, I now have two sources, but one of them is dependent upon crossing an ocean. Or if both of them are dependent upon crossing an ocean, now what? So I think there's other factors that are going to come in that it's going to be forced by the economics of doing business in the future. And then I think we'll achieve new standards after that.
So do you think that the government's attitude on price is going to change as a result of this? Will governments be willing to pay more to remove certain risks from the supply chain?
I mean, are we going to get rid of LPTA, lowest price technically acceptable?
Yeah.
That's going to take a sea change in the contracting people. But, you know, I think everybody's going to say right now, yeah, we're going to pay more. You know, my wife said I'd pay more for something that was produced in the United States if I knew it was going to last twice as long, which things I have today don't. So there's a whole list of factors that you could put on the real cost of doing business at a supply chain that you can't depend on. And I think that's a factor that will have to be taken both by government and the commercial sector, not just by government.
I almost hate to bring this up because all of you have dealt with it at one point or another in your careers, but are there opportunities then to consider changes in the acquisition policies, contract clauses to support better mitigation to supply chain risks, quality, counterfeit? If so, you know, what government entities will need to be increased to support those efforts?
Well, I think clearly there are opportunities, but reforming the acquisition process has been a goal for many people, and a lot of paper has been lost over it. I think the answer gets driven by necessity and the fact that we know you can't be agile and have a big bureaucracy that requires it. So adding is a part that the word you use that sort of bothers me. It's how do we use the existing capabilities much more effectively than we are today? What laws and regulations are in effect which actually inhibit the ability to be more effective? And so it's elimination of things as well as adding things that make us, I think, less vulnerable, reducing risk.
And Bill, I would say that two of the bigger issues that we have that are already in the acquisition process that will probably get more emphasis is the risk management assessment of what's going on, and then industrial base management. We've never really managed the industrial base to the degree that we may have to going forward. There's conversations now, Air Force is having conversations about sharing the industrial base with foreign countries that are allies of ours, and how do we do that? So I think we're going to see not a lot of changes in regulations and process, but I do think you're going to see more emphasis in the risk management piece and the industrial base management piece of the acquisition process.
Well, how do we prioritize resiliency versus low price?
Well, if we go back to the risk management, industrial base management conversation, and as Paul said, you're going to have to price the risk, assess the risk, and price the risk differently. If you have high risk and low price, it may not be the lowest price once you work through the risk equation. So cost needs to be added when you have higher risk, and that hopefully will equalize price disparity to some degree.
I think if I can add to that, Jim, I think you're raising a really important point, which is absent from the discussion is the notion of value. And people will talk about lowest price, they'll talk about lowest cost, et cetera. And perhaps there's an opportunity to balance or better balance the discussion by introducing the notion of value. We see this in healthcare all the time. And the healthcare industry has been stuck for decades in the acquisition of widgets, right? You buy stethoscopes, you buy tongue depressors, you buy test kits for COVID-19 or not. And now you have a plethora of solutions that are delivering value. And by that, they're taking out cost in many ways. And they're delivering return on investment. They're not just selling, if you would, a widget. They're selling value. And whether it's an A1C reduction in diabetes, as we do at WellDoc, whether it's a reduction in blood pressure, whether it's a reduction in cholesterol that has both immediate, short-term acute utilization reduction value, as well as long-term quality of life, improvement of life, a lessening of comorbid, hospitalizations in the future. People need to shift the basis to now discuss how you may acquire, to General Kern's comment about re-engineering the acquisition process. How do you, and we're facing that in the sale of digital therapeutics today to payers. Payers are asking, that's great. I can charge you on a per user per month basis, but I actually want to see what value are you going to deliver. Are you going to reduce my aggregate, score on a given health metric by this much or by that much? Are you going to improve my compliance to the quality measures that I'm being held accountable for which if I exceed, I get a bonus payment for Medicare? And so this notion of value, I think, must be part of the discussion on pricing, cost, and thus acquisition.
Do you think that we will or we should bring more manufacturing back to the U.S. to reduce some of the supply chain risk?
Oh, I think we will, in a few critical areas. One, and if I just look at what the Chinese have done on their Belts and Roads initiative, they've tied down a lot of things that we just say that's not going to help us in the future. We're going to have to figure new alternatives to that. I look at the whole pharmaceutical industry, and I'm clearly not an expert in that area, but how much of that supply now comes out of China? We're finding out so much, whether it's a protective gear or whether it's the raw materials that go into our pharmaceutical products. We moved that back to the value chain, and we did it in Puerto Rico for a while. Then we moved it out of Puerto Rico, we moved it to China. What are the costs of doing that? Go back to the value proposition of the risks that we are taking by extending these critical areas. We should be, I think, using this as a good lesson. At the same time, I'm also listening to some industries say, yeah, if ever we're going to pull back on all this, I'm going to double down on my work in China, because they're going to be doing the same thing. They're going to be looking at their supply chains and the fact that they have to transport everything, and how's that going to affect it? So this globalization that we talked about earlier, I think, is a part that it's not just us that's going to be looking at it. It's the world. And I think from a defense standpoint, we did a study a couple of years ago on survivable logistics and looked at the transportation costs and vulnerabilities that we have and said, this won't work in a peer battle. And we forget about the losses we had during World War II, shipping things across oceans. We're going to have to think about the world in a different way to minimize risk, increase value, and get the value in the right place.
Yeah, General Kern, you're onto something here, which is a slightly different theme on what was just discussed. Which is, if I were to put on my product or manufacturing hat, a company will never farm out those things that either control its product cost or those things that control the user experience. So there's two things that are absolutely critical for a company to own under any circumstance. They will not farm those things or outsource those things. The analogy in the current situation for us as a nation is we have farmed out things, not just in our supply chain, that are fundamental to our safety and security. And not just physical safety and security, now we see from a biological standpoint, biological safety and security. And therefore we leave ourselves vulnerable. And so will some of those things be repatriatized? I sure hope so. Because I think that if you consider the United States as a corporation, where we have to control things that control, if you would, the equivalent of a product cost or user experience, then the safety and security of that supply chain, absolutely, we have to have a bigger hand in it. And whether it's the safe and secure delivery of healthcare services, durable medical equipment, drugs, commodities, etc. At times like this, when the situation is absolutely in emergency state, the degree of control that we have over that, and therefore the rate at which we can adapt and flex, are things that we should control with more might.
Jim, as somebody who operated a facility in China for a number of years, you have a comment?
Well, China's never what it seems to be. But I'd say this, there's one thing, China's evolving at a fairly rapid rate. And they used to be perceived as a third world / developing country that we needed to send things to help them get their country economically more prosperous, with the theory that we would then sell lots of product to China, and it was a great new market, we ought to open it up. It's not that way much anymore. Back then, China was highly specialized on simplistic things, and they were very inward looking. They were worried a lot about what their society thought of them, retaining power, building the economy, getting things working for them. And if we look at them now, they control an awful lot of the global supply chain. They're much more outward looking. They're much more aggressive about presenting their views of the world and how they believe the world ought to operate. And we can't ignore any of that, because that's going on around, and it's going to continue to go in whatever direction China believes is appropriate for China. And to Anand's point, we've got to look out for ourselves, and we've got to say that there are certain countries that have interests that are slightly different than ours. And those we need to go back and take a look at and see how we want to change the risk profile in those countries. It's not just China. There are other opportunities out there, and we just need to do a very objective look at that. But we need to keep in mind China's in this for China's interests. They're not necessarily in there for everybody else's. So we need to keep it in mind.
We have a little bit less than 10 minutes remaining, and an interesting question has been submitted by an audience member, and the topic is entitled "The Data, Digital Twin, and Cybersecurity Dilemma." Let me read it to you. On the point of an adaptable supply chain, what are some implementation considerations with cybersecurity needs in DoD held in tension with the more open commercial approaches with rollout of 5G and the Internet of Things? DoD's operational risk appetite is not that of industry with this, and has been slow to adopt such things as data-rich supply chains. A brief comment from each of you.
I could go back to the report that we published 2 years ago on the supply chain, the survivable logistics report we did at the Defense Science Board. The accuracy and credibility of just the information about what we're buying is a critical part that we have not had good control of. There are some things like blockchain and other that we've looked at as the ability to ensure that the data that is left the United States and the data that is received in Singapore is the same, and at the same way it's returned. And you can apply that to whether it's 5G or 1G. Doesn't really make any difference. It's how you make sure that the data that you're moving about, which then gets to the purity of the specifications that you're dealing with, and gets to the material inspections that you apply to it. But it does not get complete 100%. It's only the data purity that we're talking about in this case. And I look at other capabilities that we're looking at right now, and the biggest vulnerability is the four of us looking at each other. It's that phishing that goes on, and people just say, I see that on my computer, I'm going to open it, I'm going to do something with it, and you've just lost $1 million. $1 million because somebody now has your data that they want to use and the ability to get in. So there's no magic to just having the technical solutions to it. It also is how you treat people and how people understand that the data that they use and the information that they're transferring is protected as well. And that is something that I think all of us in the cyber risk area have looked at. Says, you don't do that once. That's a continuous operation, because whether you want to call them hackers or whether you want to call them cyber attacks, they're good and they're quick. And a lot of it's machine language today that changes faster than you can think. So you fix one problem and you just created another. And so this is a world that, go back to Anand's comment on agility. This is agility to the 10th power that we haven't thought about, that we're really going to have to apply.
Thank you, General. Anand, but we have less than 5 minutes.
Yeah, no, Alta, just 60 seconds, which is General Kern hit it on the head, which is there are things that you do at the fundamental data layer that there are well-established standards. So one can get SOC 2 certified, for example, or high trust certified, were the highest levels of cybersecurity certification. As I said earlier, these things are not nice to haves anymore. These are must-haves. Whether it's in health, whether it's in retail, whether it's in banking, whatever, these are things we need to do. But there is a large non-technology portion of security that's human related. And we often talk about in the umbrella of what security is, encryption, authentication, and non-repudiation. One of the weakest links that we know is authentication. And who, in English, who is allowed access to data? Who actually gets access to the data? So permissions. And authentication can only be one of three forms. It's must have, must know, and must be. Must have says, Bill, I just need your card and I want to get into the building, and I get access to the building or access to a room that has data files in it. Must know is a password driven strategy where I need to know something. And of course, must be is it's got to be me, some kind of biometric, et cetera. And I think what we need to do when we look at this next world of supply chain that's upon us today, and we include sensors, data to make it agile, as we said earlier, we have to include proper authentication technologies and approaches to ensure that we remove human error. Because yes, General Kern is right. Half of the vulnerabilities are people clicking the email thinking it's something that they should open, and there's no cyber thing that's going to protect you against opening up a phishing email. You're going to do it and then you lost, right?
Thank you, Anand. It's time for the last word with Jim Brunke.
Well, I just want to carry on with what these guys said, because I agree that we got to have higher security, but I also think that in DoD you guys are going to have to drive your supply chain information all the way to the bottom. I don't think you can rely. What Boeing found out when they had their 787 problem was they were managing their tier 1 suppliers, and they really didn't put a lot of stock in what the tier 2s, tier 3s, and tier 4s were doing. And when they got into their big supply chain problem, what they found out was most of the risks and most of the production delays and most of the quality issues were at the tier 3 and tier 4 level. What you find is that those are the smaller companies. They can't afford to hire cybersecurity costs that some of the larger companies have. And so they are the ones where most of the data breaches happen. The big one that happened with Target about 1.5 years ago, they found was a tier 3 supplier. It was a little mom and pop shop that had no cybersecurity countermeasures whatsoever in their system. And guess what systems are generally connected in a supply chain, in e-commerce? The financial systems, the legal systems, and the contract systems. Those are the ones that you want to move money around quickly. And so if you can get in through the contract system or the financial system, you could pretty much get into anything in a company. So I think we've got to look out for that. Just the last thing I would say is I think these conversations are really helpful. I was really happy to be on this conversation. I really want to thank you, Bill, and the IDB for setting this whole thing up. I think we need more of these. It's just nice to have some degree of social interaction, even if it's on a computer screen. And what I always find is it's a lot easier to listen to 3 or 4 people's thoughts than to make up all those thoughts on my own. I get much better perspectives. It's a lot more robust, and these smart guys can ask questions I never even thought of. So I'd encourage you guys to keep doing these kind of things if you can.
Thank you, Jim. Unfortunately, we're out of time, and perhaps we created more questions than answers, but you know, that's how the process should start for solving complex issues. Thank you, General Kern, Mr. Brunke, Dr. Iyer, for a very enlightening conversation today. We appreciate all you do for us collectively and for taking some time to be with us this afternoon. It's been our pleasure and mission to offer today's program, Jim. It's really an important opportunity for us. And I'd also like to thank all the staff at IDB that helped put this hour together. And to our audience, if you'd like to hear more on this topic or have suggestions for more webinars, please let us know either on our LinkedIn or Facebook pages. Our next scheduled webinar will be during the week of May 11th. You'll be notified soon of that date. And once again, a link to this recording of this webinar will be sent to each of you probably tomorrow. As the airlines like to say, we know you have a choice in webinars. So thank you all again for tuning us in today, and please be safe out there. Thanks very much.